The Webster Technique is a chiropractic method of releasing the tension that's in the pelvis as well as in the uterus that may be in the way of the baby turning head down naturally as they're designed to. Usually by the end of the second trimester or the third trimester, that baby will move into the vertex position. Innately, it just knows to do that. But if there's tension in the pelvis, and specifically the ligaments that are going to the uterus, that might alter the shape or the position of the uterus, so the baby doesn't have optimal space to turn around. The Webster technique used to be called the Breech turning technique, and we don't call it that anymore because it implies that the chiropractor is going in and manually moving the baby for the mom. And that's an obstetric technique. It's called aversion. What this is a very gentle method of adjusting the spine and the pelvis so that the nerves firing to the muscles of the uterus are calm and relaxed, so the uterus can be much more soft for the baby to move, as well as taking the tension out of the ligaments, the round ligaments specifically, that can basically change the shape of a round uterus into a more oblong shape, and that may be the blockage that's causing the baby not to move down into vertex. So typically, as I said, the baby's going to turn down naturally at the end of the second trimester or at the beginning of the third. If your baby's still breech, it's important to get checked by a chiropractor trained in this method as soon as possible, because every day that the baby gets bigger and bigger and bigger makes it a little more challenging for that baby to turn head down. So if we can release that tension as quickly as possible, then the baby will be in the proper position for a nice, safe childbirth. The Webster technique, the studies that have been done around it have been shown to have an 85% success rate if we can do 6 to 8 adjustments within a 2 to 3 week period. Again, the sooner the better to get checked. So make sure that you find someone trained in this technique and get checked as quickly as possible.